case was settled for an undisclosed amount. Former patients tell HLN they bought Bouttier's claim that she's Atlanta's leading cosmetic surgeon and her credentials. Medical school at UCLA, residency at Emory, a board-certified dermatologist. But lawsuits claim she's unqualified to do many of the procedures she advertises, even though law in Georgia allows it.
If you have a medical license, then there's no restriction on what you can do.
Wow.
We have seen cases where emergency room physicians have gotten into the cosmetic surgery business, OBGYNs who are performing breast augmentations, breast reductions, tummy tucks.
Which says the focus is on Boutte now, but she's not unique. Kaylee Hartung, HLN, Atlanta.
I want to talk about this with attorney Brian Rotella. Brian, thank you for being with me. What do you make of this legal loophole that basically allows anyone with a medical license to perform surgeries like this? I mean, it makes you wonder if you can trust your doctor.
Cut it.
Hello, and yeah, it's a loophole. And look, I'm sure your audience that's watching this, I mean, it looks like something from a summer movie. You know, The Horrible Bosses, or I'm dating myself, one of the old Airplane or Naked Gun movies. But there's nothing funny about anesthesia, and that's the real issue, Lynn, as a lawyer who's been everywhere from the courtroom to the boardroom, working with healthcare companies and doctors. Folks don't understand that where Dr. Boutte was and performed surgeries is not a hospital. It's her office, and it's called an ambulatory surgery center. That's a much different environment than a hospital, and it has a lot, can have the potentials to have a lot bigger dangers, and that's unfortunately exactly what happened here to Mrs. Cornelius, and the activity, playing the songs and the music that she was doing, that would never take place in a hospital setting.
How prevalent do you think this is?
Well, you know, in 2006, listen, folks need to know that their surgeons are listening to music 90% of the time they're performing surgery. And personally, as far as I'm concerned, as long as the surgery comes out okay, I don't care if they're playing a game of Uno or, you know, doing Christmas cards. But when they're playing the music, it's to calm themselves down. Actually, that Newsweek did an article that said the #1 song played in surgery theaters is Rock Me Like a Hurricane. This seems to bring some type of pace or something to surgeons, and knowing surgeons well and representing them, they tell me that. But that's in a hospital setting where you have a lot of policies and procedures, the types of thing my business and my team help implement for hospitals. In some place like where Dr. Boutte is, you're going in there as a patient. You don't know if they have something called a crash cart. That means that what happened to Mrs. Cornelius occurs, which is a traumatic or dramatic issue in the middle of surgery. Someone's going to be able to jump on you and make sure that you're resuscitated, or that you're anywhere near a hospital where that could happen. And they weren't monitoring how much carbon dioxide she was having. Then surgery is going to sleep to have targeted trauma on you. It's going to sleep to basically have a car accident or a prize fight done on you. Would everybody out there, I'm sure some people in waiting rooms, want that to be done in an environment where you haven't asked those questions about what does the doctor do?
And you know, Brian, I think what I'm taking away from here is if you're going to have a surgery, it needs to be at a hospital. There are no exceptions here, no matter what the law allows people to do so. Brian Rotella, thank you so much for your insight.